Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
US has its own unique way of practice, different from the country. One of the most frequent questions, FAQ, that is thrown at me is that, does your rotation include hospital or not? And always listen to the patient, and I give them example of a police officer going to investigate the scene of a crime.
Morning, good afternoon, everyone. Today we have Dr. Karim with us, a physician who really wants to help IMGs, and a lot of our Sarthi students have gone to him. And today we wanted to sit down with him and get some perspective on the rotations and how that can help the students. So welcome, Dr. Karim. We are very glad you're here.
Thank you. Thank you very much.
So let's start off with a bit about yourself, your journey and how you have reached a stage where you are now mentoring the IMGs.
Thank you very much. Basically, I am originally from I was born in Karachi, Pakistan. Went to a medical school called Dow Medical College, which is one of the premier medical schools in Karachi. Graduated there in 1977. And after graduation, I did 3 years in England, where I did my postgraduate studies. I did, like they call it, junior house officer, senior house officer jobs, and graduated from MRCP exam, and also did a couple of other exams like LRCS, MRCP. So those exams were all cleared. But then I always wanted to come to USA. So I came here. And I started off with internal medicine through a matching program in Baltimore, Sinai Hopkins program, 3 years. And then I did 3 years in Baylor College of Medicine for cardiology fellowship, which included a year of interventional cardiology. And after that, immediately I went into practice with faculty appointments at Baylor, later on at University of Texas, and still later on at Weill Medical College at Cornell. And even later on at Houston Methodist Institute of Academic Medicine. So all these academic positions I still hold, except the UT position, which I don't go there anymore. So I had to give that up. Now, my basic what I do now is, of course, I'm in private practice. I'm in interventional and diagnostic cardiology, and I have my own office, my own building. A lot of facility for there's a large office, so it's not like a small crumped up office, a very big office, and that's where I do my practice and help out the students. So that's where I am currently.
So you're obviously very, very accomplished. So from a student perspective, how does a day in the life look like? What does a student end up doing in your rotations?
One of the most frequent questions, FAQ, that is thrown at me is that, does your rotation include hospital or not? And I'm very sorry to tell them, I wish I could give them another answer, but I tell them no, unfortunately not, because I have, over the last 10 years or so, or 5 years or so, I've become mostly an office-based cardiologist. So most of my practice is office-based, except for the occasional sick patient or a procedure requiring patient that is sent to the hospital, and I follow them there. But I don't have like a bunch of patients in the hospital. So starting the day, we start at 8:15. I've got 3-4 office staff here who are very attuned to the students, and they help them, show them around and show them the facility. So we start off with bringing patients in the room. And initially, we just tell the patient to just follow with me and see how I deal with the patients. And actually, the rule says that unless it's a medical school student, they're only supposed to observe you. That's what the rule says. Now, of course, we follow the rules. I tell them, look, observe me, you contact the patient, and I will examine the patient. So I take the history from the patient and teach them the basics of history, how we take the history, how we talk to them, And these are follow-up patients, these are new patients. Most of my patients are cardiology, but once in a while I get a patient for disability evaluation. I get a patient sent by the armed forces for cardiac evaluation before they can join the army, things like that. So it includes some internal medicine, mostly cardiology. And then I come out of the room, and then we have a little nursing station where we discuss the cases, not in front of the patient. And I ask them questions about what they saw and what their impression is, and how they're going to go about investigating the patient's symptoms, so forth. And this is the time that I really get to teach something to them. And my emphasis to them is that learn, and I'll come to that when you ask me about what to expect from the student, which I will tell you later. So anyway, I point out to them if they I ask them what particular things you notice about the patient, and they're supposed to tell me that. In this way, and then I tell them, okay, now you go and before we even start these rotations, we teach them the EMR, and I've got like 4 or 5 or 3 or 4 videos where I recorded just like now, where I teach them about my EMR, which is Practice Fusion. So I tell them how to pull up a new patient, how to pull up a follow-up, and how to fill the blanks. So that knowledge they already have. And when we see the cases, they go back to their desk. Each student has his own desk and his own computer terminal. So they get to write their own notes, and these notes are printed out, or they're not printed out till I see them. I correct them, and I add my own impression. Then I print them out, add my diagnosis, and so forth. And if there's any issues with the way they wrote it, I go back to them and they say, look, this is not enough. This is not sufficient narrative. You need to write more. And always listen to the patient. And I teach them, I give them example of a police officer going to investigate the scene of a crime. Have you seen them having a little notebook? They're noting everything. Who was there? Who was standing? When did it happen? Timings, so forth. This is how you investigate a symptom or a patient's complaint. Be an investigative officer and then write your report. This is what the program directors expect of you. This is what they will want you to do. If you are in internal medicine, that's what you're going to do most of your life. So they take that. Anyway, so we see these patients and it's already afternoon. They get a lunch break. And I expect them to stay till 4 o'clock. And if we have not had a busy day and if they're just sitting there, they've finished all their notes, I have a separate room with a large TV. And I open for them like Methodist Grand Rounds or some other interesting topic about 45 minutes to an hour. They all sit there and we show them the video on a large screen, and they get to learn some extra things. And then I have my own ring binders that I printed out, the history physicals and all that. And I tell them, see those, and this is how the printed material looks like when it's all done. And then, of course, I've got my own EKG teaching files and all that I get when we do an EKG on the patient, we learn on that. In the office, I've got echocardiogram, carotid ultrasound, peripheral vascular disease evaluation, nuclear stress test, regular stress test, external counterpulsation therapy. All these things they're exposed to. They watch it. They don't have to do it, but they watch it. And I mentioned that in my reference letter, that patients were able to watch all these procedures and got some familiarity with those things. Very rarely, once in a while, if I get a chance, if I'm doing a angioplasty or a cardiac cath, I can take them, at least one student I can take to the hospital. Hospital requirements are very tough. The hospitals don't want us to bring external observers. They have their own requirements. They go through an application process. It takes a long time. So not everybody gets to go to the hospital. So that's where we are at by 4 o'clock they can go home and then do their own studies and so forth.
Yeah. So this is very, very comprehensive, very detailed and comprehensive training that they get. Now, you have been in this profession long enough and associated with all these esteemed institutes. How does this 1 month or so of training prepare them for their residency match, the interviews or how they articulate their experiences?
Very good question. You and I can understand that 1 month is nothing compared to the years of training that is required. But it gives them, and so most students are supposed to do like if I'm not wrong, 3 months of US-based training. So if nothing else, it gives them a taste of US medicine. It gives them the way we approach medicine, the way we talk to the patient, the way we listen. So it nothing else, it gives them an idea of how to deal with the patient. And some of the patients are difficult, some of the patients are very kind. So it gives them an idea how to deal at least with cardiac patients. I'm not talking about, we don't have pediatrics, gynae, and other things, psychiatry and all that, but at least the cardiac patients, they get an idea. So I think it gives them, most of the students that have left me in the end, and I put some Google review or something, they always mention that they were able to see how medical practice is carried out, what tests are ordered, why we ordered them, and why we don't order them, and also some politics of the medicine practice in USA. It's, US has its own unique way of practice. It's different from other countries, so they get an idea about that. So I think it can't hurt. In other words, it only helps them. Of course, they're going to then get some more exposure in other. They may already had been training elsewhere. So, sometimes I ask them questions that a program director will ask them. Why are you interested in internal medicine? What do you want to do after this? So it can prime them as to what kind of questions to expect.
Yeah. Finally, as they come for your rotation, what are your expectations and what are the prerequisites for this rotation?
I take all students, all comers from fourth year onwards, or even sometimes third years have come. I don't take students who are not medical students, for example. There's no point. They are pre-grad, they just come for one day. Their mothers want them to see a doctor. I said them, you observe me for one day, I'll even know what life of a doctor is. But they don't need that kind. But anyway, third, fourth year onwards, I take them. And there we have a range of students that from there onwards to maybe 5 years in practice, and 6 years in practice, coming from a country that they suddenly decided to migrate here. So we have all different. What I expect them to know, I expect that the students, whether they have trained or whether they have done fourth year, fifth year, and they're still not given their final MBBS, or they've already done 2 years of house job, that they should be proficient in history and physical. I tell the students when they come to me, I say, look, you are not coming to a surgeon, you are coming to an internist, internal medicine. All our lives, we will be not doing surgeries, but we will be doing HNPs. And we should get very good at HNPs. And in my practice, and I say, when I was at your level, I would memorize that this is my topics. History of presenting complaint, history of present illness, past medical history, surgical history, allergies, diet, medicine, all these things, review of systems. You memorize this whichever way you remember, and then follow that to the letter in every patient, whether there is a short or long, you follow that. In this way, you will never forget it. You may, for example, your past surgical history may be very important, or allergies may be very important. So follow that routine every time, even if it is not applicable. So that's number one thing that I want them to know, that at least that they should know about the steps of a history physical. And then examination, I have to show them. In each case is different. I show them how a disability evaluation is carried out, how the joints are examined, how to abdominal. The old teachers used to teach us how to palpate the liver and the spleen and kidneys and so forth. So whenever I get a chance, we show them that. But I expect them to know a good history physical. And then, of course, secondarily, I expect them to know the EMR. They should have some experience doing, because this is all computerized now. Nobody's going to ask you to write a HNP. Every hospital in USA is now on computer. They're going to ask you to type out the HNP. Some hospitals, of course, have the drag and dictate and all that, but mostly they will want you to type it out. So they should know that. So that's about it. Other than that, I think they should be just mentally prepared to observe and to learn.
Yeah. Well, thank you, Dr. Karim. Much appreciate your time on a Friday, and hopefully this is going to be very useful to our students who will enjoy your rotations quite a bit.
You're welcome. Thank you very much.
Thank you.
Okay.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.